Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. Thank you for joining me in my latest video using the WAXscope. And here we have a patient who attended with a blocked right ear, and I've just put some medical grade olive oil spray immediately because I can tell by the consistency of this more lateral wax that it's going to be difficult to suction. And what the oil does, it helps to coagulate, helps to bind this wax together. And another difficulty is that the colour of the earwax is very similar to the colour of this patient's skin. And so we've got to be careful that we don't inadvertently mistake the ear canal for the earwax, especially when we're working here on the posterior part of the ear. We want to separate this wax from the canal wall, so we just got to be very careful because we can quite easily just poke the suction probe in too aggressively, too firmly, and we could bump into the canal. So you can see I'm starting to be able to separate this now. Managed to remove the more lateral wax with relative ease. However, deeper in the ear canal, this patient's earwax was impacted and trapped and lodged beyond the isthmus. So an isthmus is a medical term given for a narrowing in the body. I think it's used in universities, not just exclusively to medicine or healthcare. And that resulted in this patient having quite a prominent inferior recess and also anterior recess. And this wax was embedded beyond the isthmus and trapped in the inferior and anterior recess. So as we approach the eardrum, the ear canal narrows about 0.5 centimetre away, then it protrudes back out again. And it normally protrudes anteriorly to the front part of the ear canal, so in the case of the right ear, beyond the right hand side, and also inferiorly, so it creates almost like a base and a trench just before the eardrum. And you can quite often get dead skin and wax trapped there, and it can be very difficult to remove. And initially I used medical grade olive oil spray, but it wasn't really effective at removing this, the deeper section, so I reverted to sodium bicarbonate drops, which worked a bit better. So this wax, although it's really highly magnified, it's probably in the latter third of the ear canal, or definitely beyond the halfway point. And I'm just going to the bottom of the ear. I want to lift this upwards. Now, this patient's ear canal is more circular as opposed to oval. Typically, the ear canal, the height is greater than the width, but I would say in this patient, it's probably equal or not too dissimilar, which gives it a more spherical or round shape. And just beneath the wax, you can see the canal at the bottom, what you would have done a moment ago. And that's the patient's isthmus, that's where the ear canal narrows. And again, you can tell by the consistency of the wax that it's difficult to suction. You can see the tip of the suction tip imprinting, embedding against the surface of the wax. You may have seen that circular mark. So I've just put some more medical grade olive oil spray at this point. I'm just inserted the speculum a bit deeper so I can really widen and dilate the ear canal. And I'm just going to the back portion of the ear canal. I'm going to peel this away off the canal. And also to the bottom. And you can start seeing the ear canal underneath. Having a little opening there is useful for the drops to penetrate, so it allows the drops to seep through and lubricate and soften more of the deeper wax beyond the surface of this. So the patient's got quite a hairy ear canal. So some of these hairs are a bit deeper in the ear, so with the speculum, if the hairs are more lateral, when you insert the speculum, it kind of squashes and moves the hairs out of the way. But when they're a bit deeper, the speculum only goes in so far. We don't want the speculum to make contact with the bony part of the ear canal, which is just at the boundary between the cartilage and the bone. So it's the outer third, so about 0.8 millimeters into the ear. So this one stray rogue hair is just beyond that. Now you can see it, I'm trying to wriggle this away. On the right hand side you can see the anterior canal wall, and beyond that it veers back off to the right. So it's well and truly lodged there. So I'm just coming back posteriorly to the surface of this wax plug. Again, I'm just trying to separate it from the back of the canal wall. I'm just trying to muscle this, tease this away, but you can see that circular movement with the suction probe. It's a bit of a skin adhesion there at the bottom. And also you may have noticed there's quite a few hairs that are matted in with this wax, which always makes it more difficult to suction. In terms of using manual instruments, because there is quite a pronounced narrowing there, it's a bit tricky because we're not, to get to use like a correct or near hook, we have to get over and beyond the wax, and when you've got a narrowing in the ear canal, you just don't know where the canal is because it's obscured by the wax, and the last thing you want to do is inadvertently make contact with the bony sensitive part of the ear canal with a manual instrument. If this wasn't coming away, then we would have to revert to it and just be extra cautious, but I was pretty confident that if I continue with suction, we'll be able to remove this. So I think I'm going to have one last attempt before using the sodium bicarbonate drops. That olive oil that I put in, it's almost immediately been suctioned away. It hasn't. With olive oil, it takes a bit longer to penetrate, and it only softens the surface. So once the surface of the plug may have softened, and you can remove the softened surface element, but it doesn't fragment the wax plug, whereas sodium bicarbonate drops, it gets absorbed by the skin cells that form this plug. And skin cells are hydrophilic, so they're water-loving, and sodium bicarbonate drops does contain water, so it absorbs the water in the drops, and it causes the skin cells to overswell and expand and burst at the membrane. So it doesn't dissolve the wax, but it helps to break it up. And additionally, with sodium bicarbonate, the sodium bicarbonate element itself, it reacts with a carboxylic acid that's found in sebum, which is one of the ingredients of earwax, but it's also released by some of the bacteria that feed on earwax. And when it reacts with a carboxylic acid, the sodium bicarbonate drops converts into water again, and also carbon dioxide. And when you get that liquid to gaseous exchange transformation, we get effervescence, we get bubbling, and that mechanical bubbling is also believed to help break up the wax plug. And sodium bicarbonate drops is less viscous than olive oil, so in cases like this, sometimes it can penetrate around the wax plug a bit easier. So you can see this is the sodium bicarbonate drops that we put in. I left it for 3 or 4 minutes, and it's actually helped. It's been a lot more effective in this case than your typical when you compare to olive oil. And we're just going to bring this through, and once I remove this, you'll be able to see this patient's narrow isthmus that I was referring to earlier. You can see a bit of skin around the edge. So that's the patient's eardrum, and then the ear canal veers off to the right. You can see the canal wall, and also kind of I'm angling downwards trying to see over that inferior recess. And that's what made the procedure quite tricky. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.